Hi there, my name's Ella Hofer, and I'm here today to talk to you about the job of a reproductive endocrinologist. So the education and training required to be a reproductive endocrinologist include 4 years of an undergraduate degree. A lot of kids who want to go into the medical program in the medical field will get an undergraduate degree in biology, and some schools even offer pre-med programs. So after that, you're going to go to a 4 year medical school and you're going to get a PhD in obstetrics and gynecology. After that, you got another 4 years of obstetrics and gynecology in a residency. And then you have a 3 year fellowship in reproductive endocrinology. In total, that's going to be 15 years of education and training. So some of the duties of a reproductive endocrinologist. So they diagnose and treat infertility in women. And they also can diagnose and treat disorders of the female reproductive tract. They can care for pregnant women. Sometimes they deliver babies. And then this also includes a lot of surgeries and procedures. And they also deal with a lot of pharmaceuticals to help with the hormone part of infertility and stuff like that. So they also do some sperm banking, egg freezing, and artificial inseminations. So Dr. Rashimi Kudesia is a registered reproductive endocrinologist, and this is an average day in the life as her. So she works about 50 hours a week on average and 10 hours a day. She's on call every 4 to 6 weekends. And in the morning, she's often doing monitoring, which includes blood work, ultrasounds, etc. And she likes to see a lot of patients in a short amount of time during this period. She also does office work and consultations a little bit later in the day. And sometimes she does operations such as IVF, which is in vitro fertilization. She does surgeries and also some egg retrievals. And on the left, you can see a picture of her. So in California, the average salary of a reproductive endocrinologist is $291,000. The range is $254,000 to $340,000. Generally, the salary in California is going to be a bit higher than other states because the cost of living is really high in California. So the job outlook projected is positive 4% growth between the year 2019 to 2029. So the personality type required to be a reproductive endocrinologist and be successful in the field is going to be that you have to have some patience and compassion because this is a very emotional field. So a lot of people come in and need to see a reproductive endocrinologist because they're having a hard time getting pregnant or they have other issues. And a lot of times this results in frustration on the patient's part, and it's really emotional, and you have to be very compassionate to help them through it. You also have to be persistent. So with IVF, in vitro fertilization, sometimes it doesn't work. And so you have to keep trying over and over again with the same patient to make sure they get the results that they want. You also have to be analytical and personable. Since this is such a touchy field and deals with miscarriages, infertility, stuff like this that can be really hard to handle on the patient's end, you have to be kind of sensitive to them because they want to feel safe and comfortable with their doctor. So as a personal response, I wrote that I would love to be a reproductive endocrinologist. I feel like I have the outgoing personality and hardworking ability to pursue this career. I would love to help women and be a part of the circle of life. I really love, the whole process of children being born and all of this stuff. So if I could help women, achieve this and, bring children into the world and all of this different stuff, I would love to do it. And I just would love to help women with their struggles and all this kind of stuff. So I would really love to have this job. And these are my APA citations. And here is my professional attire. Pretty drippy. Okay, that's it. Thank you so much for watching.